hardcore about trying to get back to business as normal. When even though we've been trying to tell y'all there was no such thing as business as normal. This Delta variant has really changed a lot of things, and it has people now saying if you're going to be even indoors and you're vaccinated, to wear a mask. Joining us right now, we've had him on the show before, Dr. Georges Benjamin. He's been on the show before. Glad to have him back. He, of course, works in the healthcare industry. We had him on a lot last year. He's executive director of the American Public Health Association. Glad to have him here. Doc, the thing that is a trip to me is there's no flip side to death, and I keep saying that. And you have these people who are so adamant, these people who would say, oh, I'm not trying to get sick. Now you have people who are begging for a vaccine because they're in the hospital. I saw a story the other day, a 24-year-old guy needs a double lung transplant, and his mom is now telling everybody, please don't do like my son did, make fun of this vaccine, and then desperately need it. But the CDC, some are saying that the CDC is giving conflicting information. I saw an interview where Dr. Anthony Fauci said no. He said the problem is the Delta variant is what changed, not the CDC. Your assessment of this new mask mandate, and what's going on?
Yeah, let me just tell your listeners, Roland. By the way, it's good to see you again. This vaccine is important, and this new Delta variant is no joke. It is highly infectious, more infectious than the original virus, and that's why they're saying, look, we need to take a step back. We need to wear that mask, which is protective. But at the end of the day, this pandemic is now in the communities of people that are unvaccinated. And that's the fundamental problem. At this point, it's get vaccinated or get COVID. And COVID, as you can see, is very serious. And it's now impacting not only the folks that are unvaccinated, but unvaccinated young people are getting this disease. So it's very serious. And the CDC, I think, did the right thing by pointing out the fact that not only does it infect people who are unvaccinated, but even infects a small number of people who are vaccinated who could then spread it to others. And so what they're trying to do is trying to get ahead of the curve here and just protect us all.
Well, and I think that when you're seeing these numbers explode in Arkansas, Mississippi, Alabama, Louisiana, and we're seeing. I mean, I posted one or retweeted this one doctor, I think it was in Arkansas, who said every ICU in the state and in 4 neighboring states are completely filled.
No question about it. Look, 22% of the new cases are in Florida alone, and about 40% of the new cases for those 5 states you just mentioned: Florida, Arkansas, Louisiana, Missouri, and Nevada. So we know these are also states which have very low vaccination rates. And in fact, half of the counties in our country still have vaccination rates less than 40%. So we have a lot of work to do because this is a very dangerous strain of this virus.
Yeah, but I thought everybody was hailing Governor Ron DeSantis for showing leadership when it came to dealing with COVID.
Not me. As you know, I've been highly critical of many of the things that have happened in Florida at the leadership level, not necessarily at the health department level, although I know they've been struggling to try to deal with the challenges of really policies that don't make no sense. How do you have such a big outbreak and say that even private businesses can't require people to wear a mask or can't require people to be vaccinated? That makes absolutely no common sense. And I don't know how some of these communities have lost common sense. It's just beyond me. And I, as a physician, I only care about their health. I don't want to get into the politics of it. But at the end of the day, this has become a very political and politicized disease, and that has to end or people are going to die.
Questions. Scott Bolden, you first for Dr. Georges Benjamin.
Yeah, hey, Doc, Scott Bolden here. The Delta variant, we weren't as impressed with it, let's say 1 to 3 months ago. We knew it was in Europe and Asia and other parts and stuff. if I now have to wear a mask and I've been vaccinated, will there come a time where I will need a booster shot for my vaccination, to join my original vaccination if this Delta variant begins to spread more?
Yes, Scott, thank you. Yeah, this we've watched this, unfortunately, this virus grow, and we had anticipated that more people would get vaccinated, and that would bring it to a screeching halt, but that did not happen. And so now we're
Mm-hmm.
having to deal with this particular variant, which is highly infectious. And the answer is it's possible that we may need a booster shot, but I got to tell you, it may not be for this Delta variant, because one of the things I am more concerned about is the fact that as this virus spreads from person to person, we may develop a homegrown variant of an American variant of this virus, which will totally escape the vaccine. And then we'll all have to be revaccinated. And so it's possible we'll need boosters down the line because there is some talk about that.
Wow.
We're not there yet, but I'm more worried about the virus that's going to follow Delta because people aren't paying attention to it.
Well, how does that happen, if I may, Roland? How does that happen, and how does this variant attack our bodies different than the original one, the original pathogen?
So let's just understand that every time you get infected by a virus, it makes copies of itself. And it doesn't make one or two copies of itself. It makes millions of copies of itself.
Wow.
And sometimes when it makes copies, it makes mistakes. And sometimes those mistakes make it more virulent, meaning it makes it more dangerous. And sometimes it makes it less virulent. In this case, it made a virus that is more transmissible. And the way I like to think about it is it sticks to your body tissues more readily. And in doing so, that means it can go into your body easier. And when that happens, it can reproduce much more quickly, make more copies of itself. And the more copies it makes of itself, and the more it sticks to your body, the more likely it is to infect other people when you come in contact with them. So think of it as being contagious. Even though you're vaccinated, you can, with this new virus, this new strain, in a small subset of people, it attaches to their body so tightly that reproduces itself. It still doesn't make those people real sick if you're vaccinated, but it does still allow those people to contaminate others. And if you're totally unvaccinated, you get, you can clearly make other people really sick as well as yourself.
Thank you.
Robert Patillo.
My question is about vaccine hesitancy, particularly as it relates to the African American community. I feel like we, as communicators, we could have done a better job of explaining the vaccine and what to expect to the community at large to try to quell some of these concerns. People have the concern saying, "Well, it was developed so fast." No, it wasn't. We've been working on coronaviruses for the last 20 years in developing a vaccine, or explaining exactly how an mRNA vaccine works compared to other sorts of vaccines. What do you think the community can do better to communicate the nature of the vaccine and its effectiveness to individuals who are still hesitant to ameliorate some of these concerns and raise vaccination levels?
Yeah, Robert, we need to do exactly what you did.
Before
We
Doc
need to tell
answers,
people.
hold on, Doc. Before you answer
Okay.
that, I'll preface this before he answers that. The federal government needs to make sure that the ad agency that is sending all this money out is spending it with black-owned media. Here's the problem.
Yeah.
They just sent all this money out to all these different people, largely ignored black-owned media, where we could have been able to doing a lot more specials, could have been on the ground. Doc, I can tell you, my folks, we submitted a plan for us to actually do micro-targeting, going to specific cities, specific neighborhoods, broadcasting our show, bringing the experts there, could not get them funded, yet we saw the ad agency spend millions of dollars. And the phrase that was used was spray and pray. That just throw it all over the place and pray it works.
Yeah.
And I'm sitting there going, what's going on? And I'm telling you, so that's part of the deal. And black groups were grossly underfunded when it came to COVID. And then it's like, oh, can you please come and save our ass? And that's always been a problem. Go ahead, Doc.
I'm glad you said that. Look, I've been doing public health since 1990. I was a health commissioner in Washington, D.C. And you know how we got to the black community? Obviously, even in D.C., which is predominantly African American city at that time, We went to radio. We got people banging on doors. We went into communities. We put ads into African American newspapers. We went and talked to people in the hood. And this is not rocket science. This is not something that is a new revelation. So everything you said about the importance of not only using the right messages and the right messengers in terms of people, but you also have to have the right messengers that are the communications vehicles that people listen to. Because I can tell you, I don't listen to many of the same radio stations or watch the same TV stations, or even be on the same social media networks that many other communities that don't look like me are on. So you're absolutely right about that. And we should have done this earlier. We should have had a much more targeted conversation about communication. The whole issue about the fact that this is not, this is a vaccine that has been put together and researched very quickly because of this new virus. But we actually know that, as you said, for over 19 years, we've been researching coronavirus vaccines and using mRNA vaccines in our studies for Ebola and the flu and other diseases. And, you know, not a comprehensive communications plan. And we've all been critical of that.
Well, bottom line is this here. Look, I will show you the priorities where they spend the money, and I'm telling you that's been part of the problem. And so now they're trying to play catch up. And Doc, the thing that's frustrating, my team gave a detailed plan, and we said we want to target southern states where our people are, especially in rural areas.
Yep.
And again, they chose to spend this money. And this is what happens when you got black targeted media. They want to spend the money on BET and Complex because they reach African Americans online. Guess what? It's a whole bunch of black people, and look, this is a digital show, who are not sitting here on these social media websites. They're not doing that. You got to be able to touch them. You got to be able to talk to them, and that's the whole deal. And so hopefully, we want our people, folks. We want y'all safe. We want y'all living. We want y'all, to really be a part of this. And it's just don't, please, Doc. I want you to close us out. Just give people a direct plea so they understand what's going on.
I want everybody to get vaccinated, because if you get vaccinated, you won't get COVID. You won't get COVID. You won't get sick and die from COVID. That's the important thing.
Right.
Get vaccinated, or don't get serious COVID, and then wear a mask, particularly if you're in a hot zone, because if you do that, it will help. But you still need to get vaccinated. And we now also recommend that everyone working in a school, K to 12, now is vaccinated, while you're indoors, because we think that's very important to protect our kids. By the way, our young kids are not yet eligible to be vaccinated, and that's why they want everybody to wear a mask.
Folks, back to our Roland Martin Unfiltered video in just one moment.
Racial injustice is a scourge on this nation, and the black community has felt it for generations. We have an obligation to do something about it. Whether it's canceling student debt, increasing the minimum wage, or investing in black-owned businesses, the black community deserves so much better. I'm Nina Turner, and I'm running for Congress to do something about it.